Hello everyone, this is Dr. Ghazal Ahmed and welcome to my class. In today's class, we are going to learn the clinical features of gonorrhea. The first thing to remember is the incubation period in gonorrhea is very short. It is just 2 to 5 days. But it can be as early as 1 day and as late as 14 days. So first we'll see what happens in males. We have the diagram. We can see there is bladder, prostatic urethra, membranous urethra, bulbous urethra and penile urethra. This is the urethral meatus. The four parts of the urethra are divided by a perineal membrane here into anterior urethra. This is the perineal membrane, and anterior to this, that is bulbous and penile urethra, makes the anterior urethra. Posterior to this is the posterior urethra. So in gonorrhea, there is inflammation of the anterior urethra and it causes anterior urethritis. Why this happens? Because the anterior urethra is lined by columnar epithelium. And gonorrhea prefers the columnar epithelium for invasion. Urethral meatus is lined by stratified squamous epithelium. The posterior urethra is lined by transitional epithelium. Inflammation of the columnar epithelium in anterior urethra will cause discharge, and the discharge as described is very profuse, thick, it is purulent and yellow in color. This is the main feature. The patient presents with this complaint. So the urethritis causes discharge. The other complaints of the patient is difficulty in micturition. That is, they have dysuria, frequency and urgency in micturition. On examination, what we see is there is meatal erythema and edema. Prepuce might or might not be affected. There is a term called bullhead clap penis. Here the clap seems to be derived from a French word, clapiers, that means rabbit's nests. In slang it indicates brothel, and these were very prevalent in Les Clapiers district of Paris. The second hypothesis is that it is an English word. It is derived from clapan, that means throbbing, that indicates the pain that is associated with this. Well, the bullhead probably indicates the erythema and edema of the meatus. There is another term, the drip. This was previously used for this gonorrhea due to the profuse discharge. Now we'll move on to the clinical features of females. Females presents with mainly cervicitis. Rarely they do present with urethritis, so we'll learn the cervicitis. There is inflammation of the endocervix. Why? Because the cervix is divided into endocervix and ectocervix by the external os, and it is lined by columnar epithelium, again which is easily invaded by gonorrhea, while the ectocervix is lined by stratified squamous epithelium, and this lining is incontinuous with the rest of the vagina. We should know why the stratified squamous epithelium is difficult to invade while columnar is easily invaded by gonococci. So the first reason is that the stratified squamous epithelium is thicker. It is multi-layered, while Also that it is regularly shed, so it is difficult for the gonococci to establish an infection. The third reason is that there are proteins which are expressed in columnar epithelium which are not expressed in stratified epithelium, which helps in the adhesion of the gonococci to the cells. But in prepubertal girls, the lining of ectocervix and vagina, though it is stratified squamous epithelium, they are thinner and they have alkaline pH. So vulvitis is very common if they are infected by gonorrhea. So we should always rule out abuse if we see vulvitis in prepubertal girls. This happens because they are yet to come under the effect of estrogen. So now there will be discharge from the endocervix, which is not as profuse as in males, but the characteristics are same, yellow purulent. There will be erythema and edema of the cervix, and they also have a complaint of post-coital bleeding. Females may also present with urethritis. The urethra of females are lined by stratified squamous epithelium. Also, the urethra is short, very short as compared to in males. So in these two reasons, the discharge due to urethritis is same, but it is very scanty, and there might be meatal erythema and edema of the urethra. Since the urethra is involved, so there will be difficulty in micturition with complaints like dysuria, frequency and urgency. So this is all for clinical features. You should remember only 50% of all infected females are symptomatic. Others go unnoticed because of the anatomical differences. I hope this helps you in your study. Thank you very much.